The Surveillance Disease Prevention and Control Division of CARPHA supports the agency in providing strategic direction to its member states. So what does strategic mean? It means that we must take an evidence-based approach. So in 2024, several departments worked together to ensure that we roll out our integrated surveillance strategy and to optimize efforts to get real-time surveillance. The health information communicable diseases, vector-borne diseases, tourism and health, environmental health and sustainable development, and many others work together towards this common goal. The reality is, however, that public health is not just limited to that in terms of challenges. We also had departments such as Caribbean Regulatory System, Medicines Quality Control, and Surveillance Department implementing different activities to ensure that we have access to safe and quality medicines. And that's not all. We also had the Chronic Disease and Injury Department that looked at non-communicable diseases. And I'd like to highlight the efforts done in particular related to cancer and cancer registries across the Caribbean region. The reality is, even though I've not mentioned all departments, that we work together as a team to build upon successes and improve the regional health security.
CARPHA supported the development and launch of the DH2 cancer module in Jamaica, and 9 member states received training in childhood cancer registration, with 16 countries receiving training in the NCD surveillance framework and reporting tool. We also published the 7th Food and Nutrition Bulletin. Under risk reduction, we completed the Caribbean Moves framework endorsed by CARICOM to address NCDs through a multi-sectoral and socially inclusive approach. We made progress on the 6-point policy package through technical review, partnerships, and collaboration. Additionally, 16 member states benefited from behavior change intervention training. In disease management, 40 healthcare providers in St. Kitts and Nevis were trained in CARPHA's clinical guidelines and the nutritional management toolkit.
The CARPHA Medicines Quality Control and Surveillance Department continued to have great impact on the public health of CARPHA member states through our work supporting access to good quality essential medicines. We achieved this through testing of medicines in our risk-based post-market surveillance program of medicines quality and testing of medicines at the request of member states for their own regulatory needs. We also provided information and advisory services on medicines testing, and we continue to provide training and support to the National Medicines Quality Control Laboratories of Jamaica and Guyana to become accredited. We also provided capacity building for at least 11 CARPHA member states in our webinar Understanding the MQCSD Certificate of Analysis and the results provided.
Here at the Caribbean Regulatory System within CARPHA, our primary aim is to ensure the continual access to safe, effective, and high-quality health products, including medicines and vaccines. Our work can be divided into 2 categories: product reviews and product vigilance. Some of our achievements in 2024 included the implementation of the DHIS2 modules. This facilitated more secure reporting of suspected adverse events associated with medicines and vaccines. We introduced AVR supplier from OECS PPS to the CRS verification review process. 50 focal points from 7 CMS were enabled to use the CRS collaborative review pathway for the review of medicines and vaccine dossiers. We also published 12 VigiCarib newsletters, which reported on 66 ADRs, 4 AEFIs, and also 19 substandard and falsified products detected in the region. Finally, we provided CARICOM MS with 31 recommendations for market authorization of quality assured medicines.
Vector-borne diseases continue to pose a threat in the Caribbean region. In fact, in 2024, We had outbreaks of dengue with threats of outbreaks of Oropouche. The reality is we were required as a department to implement several interventions to address this problem. We would have had one workshop on integrated vector management, which would have been done in Antigua, and we would have had more than 20 participants. We had 2 workshops on insecticide resistance testing, one in Trinidad and Tobago and one in St. Kitts and Nevis, and together we would have trained more than 50 persons. We had 3 workshops in geographical information systems, and as a result, we would have been required to implement also regional workshops. In November of 2024, we had a large regional workshop in the Cayman Islands that looked at improving networking for improved responses to vector-borne diseases. And there we would have had more than 70 participants. Early in the year, we also had a workshop which looked at CARIVECNET, the Caribbean Vector-Borne Disease Network, and there we had about 15 member states with 50 in-person attendees and 50 online. The reality is that we implemented several other interventions, including machine calibration and maintenance, as well as arthropod identification workshops. So we look forward to building on these successes in 2025.
During the T20 Men's Cricket World Cup 2024, the HCE unit joined the CARFA team in working in supporting member states. Support included identifying their risks through conducting mass gathering risk assessments, facilitating in-country simulation exercises, and rapid response team training. The activities successfully pointed to gaps and guided countries to address them. The unit has been very excited about the advancements in the CARFA information system tools. More countries are reporting directly into CARFA's DHIS2 information system and have access to analyze their historical data. We have also begun developing integrated data visualizations, starting with datasets housing communicable diseases, syndromic, and laboratory data. Finally, HCE team processed over 28 years of mortality data into the regional mortality database and successfully completed the physician sensitization slide deck on the completion of the medical death certificate for physicians.
Here are some key achievements of 2024. We became the first in the region to detect the Omicron variant JN.1, enabling a rapid response to this highly transmissible disease. During the Cricket World Cup, our lab teams mobilized quickly to provide critical emergency response to participating member states. CARFA was also the fastest globally to submit molecular external quality assessment for measles and rubella, showcasing our commitment to quality and accuracy in our laboratory operations. And finally, to build capacity, the agency trained 12 member states and 3 staff members as certified trainers in safely transporting infectious materials, thereby equipping the region to manage samples for regional and international referral testing.
The Environmental Health and Sustainable Development Department, founded at SEHI, delivered a robust program of work and support to our member states in 2024. Our core objectives were to strengthen human resource capacity, strengthen programs, and strengthen country systems. Key initiatives included developing national water quality monitoring programs for 8 CARFA member states, developing a pesticide monitoring program for another member state. We empowered Caribbean professionals in the sectors of environmental health, environmental management, and water resource management by providing opportunities to develop and implement potable water quality monitoring and pesticide monitoring programs, conduct wastewater monitoring and analysis, perform hydrological modeling, and gain exposure to emerging technologies such as machine learning. Essential skills to collect, package, and ship environmental samples were also included. We delivered and developed an environmental health module for surveillance in DHIS. Through partnership with the UN Environment and the OECS Commission, we finalized a regional action framework for integrated water resource management under the IW ECO project. Finally, our accredited environmental health laboratory provided essential laboratory services through the provision of data to our clients. This facilitated the fulfillment of safety obligations in respect to duty of care in the case of our clients in the private sector, and support to monitoring, surveillance, and research across the Caribbean region.
The Monitoring and Evaluation Unit supported regional M&E system strengthening, provided capacity building and technical assistance to 13 CARPHA member states, and trained 91 public health practitioners in monitoring, evaluation, data appreciation, and strategic planning. Some of the key outputs of the M&E unit include the addition of 127 SDG indicators with disaggregates to facilitate monitoring and reporting. Additionally, we convened 2 regional stakeholders and partners meeting, and as a result of the CARICOM Spain Health System Strengthening Project, we initiated the process to establish a Memorandum of Understanding between CARPHA and SECOMISCA.
During 2024, the Caribbean Regional Field Epidemiology and Laboratory Training Program had several key achievements. 2024 was the 10th year anniversary of the program, having been formally launched in 2014. To date, the program has trained 430 graduates from 18 CARPHA member states in disease surveillance, outbreak response, and emergency response. Locally, graduates were able to detect and put in place prevention and control measures for food and vector-borne disease outbreaks, respiratory outbreaks, and also respond to natural disasters such as Hurricane Beryl in affected countries. To support these efforts, the CRFLTIP program developed a rapid response team workshop, which was rolled out in 9 countries last year. To demonstrate our continued commitment to international training quality standards, the CRFLTIP also reaccredited CARPHA as a continuing education training provider for the period 2024 to 2029.